When we start with surgical instruments, initially, again, scalpels are here, right? You have a 15 blade or a 10 blade. These are all good for making incisions. An 11 blade is a more sharp for a punch biopsy or like a stab incision, kyphos, mild, things like that, right? So either one, you can use 10 or a 15. I prefer to use a 10, it's a little larger, but whatever your preference is. Then you talk about scissors. Anyone know these? Name of these scissors? Metzenbaums, right? And then you have Mayos. The Metzenbaums are skinny. These are nice for getting deeper into, you know, the incision to cut your anchors or, to cut the suture on your anchor. Metzenbaum scissors, Metz is what they're called. You know, these are just needle drivers, so there's different sizes, different shapes, needle driver. This is a Kelly clamp. There's a bunch of different clamps. You know, your forceps here, you have, again, I couldn't remember the name of this. I think it's a Coker forceps, but don't quote me on it. You have DeBakey's, so these are two different types of DeBakey's. DeBakey's have teeth or without teeth. Most of the time they don't have it, so these are long and tapered. This helps greatly with holding the anchor and advancing it, you know, down when it's deep. Now, when I'm closing skin, I like an Anson with teeth. So this is an Atson with teeth, all right? You have Sens, sharp Sens retractors. Again, be mindful, these are sharp, and so when you're gonna put tissue up, when you asked about lateralizing your incision, this is good to kind of hold and then make a lateral incision. You have Army Navy. Don't know which one is which, but I'm just kidding. One side is it's Army Navy or Navy Army, whatever it is. These are also really good for your pockets, you know, when you need sort of a little bit more exposure, but don't be that sort of self-retracting, you know, assistant where all you get to do is retract and then your tendons do it all else, you know. These are rakes. You know, you got a classic mallet here. You have different size Wheatlanders. So these are great for kind of holding your incision open when you need to make your anchors. So know what the instruments are called. This needle is a coude needle, so it's a slight curve on it. This is a large coude needle. This is great for large patients that you have to enter perpendicular. Because of the curve here, you have better chances of placing your lead posterior in the dorsal column. Now, one of the little tidbits I always talk about is strategies to, you know, sort of get into the space. With these straight tuies, you can rotate them and actually, so if you're running into, you're hitting lamina, you're trying to adjust and you end up cranking on this needle and you just continue to hit lamina, you can rotate this 180, right? Your tendons are gonna love me when you try to rotate this bevel, right? But you can rotate this and get your loss. It slips perfectly under the lamina and then rotate, right? You never wanna do that with a coude needle because it's sharp and you can stab. So one of the things that you can do when you're struggling, rather than replacing or redoing, is just rotate it 180, allow this beveled side to kind of, you know, just slip right underneath. What's that?
I did that once in the market.
Yeah. And again, it's like,